Hi, everyone. It's Anne from Aging Gracefully at Women-S, and I am thrilled today to be speaking with Dr. Sasan, the founding physician and chief innovation officer at Kindbody. Welcome, and thank you so much for joining me.
Thank you for having me. I'm a huge fan of Woman-S and a bigger fan of increasing awareness and education about the perimenopause, menopausal period, which is such an important and for far too long neglected part of our reproductive health as women. So
Absolutely.
thrilled to be here with you and excited to have this conversation.
So tell us a little bit about Kindbody, the clinics that you have all across the country, and your mission to change the way we look at healthcare.
Sure. So I am the founding physician of Kindbody. I'm a board certified OBGYN, and Kindbody was founded in August of 2018. So we're about to celebrate our 6th birthday. And the entire focus and concept of Kindbody was to improve access to fertility care. And then more broadly, when we think about reproductive care, and it's truly a mission and vision from the heart of the understanding that, first of all, fertility care impacts 1 out of 6 adults, and it is not agnostic to gender, so it impacts men and women. And it's not just something that is a female problem. I think societally, we thought about it for so long as being just a woman issue, but we now know that up to 40% of the time, fertility issues can actually be male related. And then obviously, if you add in the LGBTQ plus community, people who want to have children as single parents by choice, and so on and so forth. And so a true mission of improving access to care. And so we have developed and built clinics across the country. So it would be 38 by the end of 2024, brick and mortar locations in addition to virtual care. And we serve the community in that people can come to us through their insurance, just, self-pay. But in addition, and probably the part I'm most proud of, is we partner with large employers to provide benefits to their employees, which then allows us to provide access to this type of care that's historically been only available to the top 1%. Now the cashier at Walmart, for example, has
Right.
these types of benefits. And then the last piece I'll say is that it's always been very important to us, then while we right now, a lot of our focus is on fertility, is understanding that a woman's reproductive life is not just about having a baby,
Sure.
and that our reproductive life starts from our first period and puberty for men all the way through menopause and beyond. And as we think about the average life expectancy, all of a sudden you realize that there's so much beyond that 25 to 45-year-old where we're focused on potentially having children, or that or not having children, and contraception, and that there's so much more to that reproductive journey. So one of our other missions as a organization is to end the fragmentation that exists within women's health, and to ensure that people are empowered and educated about the full spectrum of their reproductive journey. Because I think there's a lot of education about pregnancy,
Sure.
and a lot of education about contraception and preventing pregnancy, and not a lot of education about that perimenopausal, menopausal period. And so our goal is to really equal the playing field, to make sure that every man or woman feels that they have the information they need about their bodies.
Right. It wasn't too long ago that those topics were taboo. I know I'm almost 54 years old. I actually did IVF for my 3 children 20 some years ago. Nobody talked about it back then. My mother said, "Why are you talking to people about what you're going through?" And I'm like, "Mom, I would talk to the bus driver if that bus driver was able to help me. I'll talk to anybody about it." Now, more and more people are talking about infertility. They're talking about IVF, surrogacy. The conversation is happening. Finally, now this generation that sort of started talking about that more openly is now finding themselves in perimenopause and menopause and going, okay, wait, now here's another topic that women aren't talking about, not being able to get or able to find answers to. Even for me, I was in perimenopause for probably 10 years,
Mhm.
and I didn't know so many things of what I was going through. And so it is great that there are doctors and clinics out there that are able to help women understand what's going on and then find solutions so that they have a better quality of life. Let's talk about perimenopause. What is the definition of perimenopause?
So perimenopause is a transition period. And I think that it's really important before we talk about perimenopause, just definition of menopause. So menopause is defined as 12 consecutive months of not having a menstrual period. Obviously, in the absence of contraception, like if you have an IUD and you're not getting a period, or you're on Depo-Provera, obviously, but it's the natural cessation of your menstrual period for 12 consecutive months. And the timing is really important. And the average age of menopause in the United States is 51, 52. That's the average age. And so with any average, some people happen sooner and some people happen later, right? And the key thing to understand is that this perimenopausal period is that transition. Menopause is not a switch. It's not like one day you're getting your periods like clockwork and the next day you're in menopause. Hence the definition of 12 consecutive months. It's a transition. It's a slow decline in your ovarian function, right? So our ovaries are the primary producer of our estrogen and progesterone hormones in our bodies. And there's a slow transition. Think of it like a slow slumber, but a slow stopping of the function of these of the ovaries. And so it's not that the hormones go from 0 to 60 or from 60 to 0 overnight. They're slowly declining. And as you can imagine, with anything that happens in our bodies, every person is different. So for some women, that perimenopausal transition, so the transition of going from a fully functioning ovary that's producing, normal amounts of estrogen, progesterone, to an ovary that's now quiet and no longer producing those hormones, which is officially that menopausal period. That transition period varies dramatically. So some women have short transition period, maybe a year or two, and other women could have a very long transition period. And then I think maybe the most confusing is everyone also experiences it differently. And I'm sure we'll talk about that.
We certainly will. So if you have gone a full year without your period, you are officially in menopause. One thing we hear a lot is post-menopause. You're just in menopause, right? For the rest of your natural life. You're in menopause. Is there a difference between post-menopause and menopause?
Yeah, no, I mean, technically from a purely medical perspective, no, it's kind of like once you're in menopause, you're in menopause. That means your ovaries have stopped producing estrogen and progesterone hormones. I think maybe why some people talk about the post-menopausal period is the period where they stopped being symptomatic. And so technically from a medical perspective, there's premenopause, there's post-menopause, or there's menopause, and that's it. So it's a very binary. You either are having functioning ovaries or you're not. And so that from a medical perspective is black and white. But from a symptom perspective is where I think the word postmenopause comes from, where you started having symptoms, you've officially not had a period for 12 months, but you're still having symptoms, which is true. And then there's a point where many women do get, and for those of you who are experiencing menopause symptoms, there is an end. But at some point, majority of women will stop having symptoms. The hot flashes go away, the night sweats go away. And I think that's what people refer to as post-menopause. But just from a purely medical perspective, you're either premenopausal or you're menopausal.
So if you go a full year without your period, and then say a month after that full year, you get your period, what happens?
Yeah, so it's really important if you've had 12 consecutive months of not having a period. And I do want to highlight too that you are in that, 40, mid to late 40s into your 50s, because obviously there's other conditions where someone who's 30 may not get a period for a year. So I don't want, your audience to get confused. But if you are in that age range of your, mid to late 40s and beyond, and you had 12 natural consecutive months of not getting your period, and then you get a bleeding, even if it's just a spot, even if it was just for a day, even if it was just a stain on your underwear, you should see your OBGYN. So post-menopausal bleeding, meaning once you've had 12 consecutive months of not having any bleeding, and then you start bleeding again, that shouldn't be ignored. It shouldn't be considered a normal part of a transition, and you should see your OBGYN. Now, I'm not trying to scare you to say there's something wrong, but at that point, we do want to have evaluation by a physician, typically an ultrasound imaging to look at the uterine lining, and then sometimes even a biopsy, because in those cases, we want to ensure that there isn't a uterine or endometrial cancer that's causing the bleeding. And so post-menopausal bleeding should be taken very seriously and always evaluated by a physician. And in that case, it's always best to be safe than to ignore it.
What are the most common symptoms of perimenopause? What is happening to the mind, to the body? How many are there? How many symptoms? I've heard anything from 32 to I heard somewhere 72. I was like, everything, throw it in the bucket. It's menopause.
Absolutely. I think it's just really important to understand that this perimenopausal, menopausal period, especially as it comes to symptoms, is not cookie cutter, and that everyone experiences it differently. And you know, not to make anyone who's watching who's going through a lot of symptoms feel alone, but there are some people who experience menopause without any symptoms. There are women who have not a single hot flash and just naturally go through the change. I would like to say those are the lucky ones, but there is an asymptomatic transition that happens for some women. And then there are some women who have this, dozens of symptoms. And I think what's important to understand is, first of all, whatever you're feeling is what you're feeling. Whatever symptoms you're having are real, and that you shouldn't feel ashamed of symptoms that you're having. You shouldn't ignore symptoms that you're having. Our goal as women, and for me as a physician, is always to say, look, you should be comfortable. That this concept that being uncomfortable is the new normal and things that people say. I really, want to champion that doesn't have to be the case. And so to not be afraid to talk about symptoms. So some symptoms, let's kind of talk about the most common. Certainly hot flashes are very common, but I also want to talk about that they can be wildly variable. There are some people who say, yeah, I feel a little hot for a minute, and then it passes and it's just a few seconds and it doesn't actually bother me that much. To women who will say, I was standing in front of a boardroom and having a very major meeting, and I started sweating and sweat through my clothes, and it was embarrassing, and I felt flustered, and I felt almost a panic anxiety sensation. So there is a huge range. Night sweats, obviously same, it's just an extension of those hot flashes, but tend to be more common at night. There can be certainly mood changes, insomnia, so difficulty sleeping. There can be a brain fog that people often talk about. Sometimes joint pain, things like that can be an issue. But what I think is important from vaginal dryness and pain during intercourse. But one of the things that I like to kind of help explain to my patients is sometimes it's a domino effect, right? So the fact that your mood feels disrupted or you feel like you're not thinking might be because you didn't sleep at all, and because you had like 50 night sweats. And so it's not necessarily that the menopause is affecting your memory. It's that if you haven't slept for, whatever, a month, then obviously that's going to affect your mood, which will affect your memory. And so I do think it's always important to think about the root cause. Or if you're having intimacy issues with your partner, it may be a result of the vaginal dryness, not just that because you're menopausal, you don't want to have sex anymore. So what is the root cause of the symptom or issue that you're having? Because typically we can address the root cause, which will then have a nice domino effect on the other aspects.
Right. We're a house of cards, right?
Yeah.
And I know for me, if I don't sleep well, and I was suffering horrifically from the hot flashes, all of a sudden, like a freight train, all day, all night, I had anxiety to go to sleep because I knew I was going to wake up 4 or 5 times in the night, just soaking, changing the sheets. Um, then you're not eating well because you're not sleeping well. You're crabby. All of a sudden, grabbing ice cream seems like a good solution. And then you're getting, of course, you're getting that tire around the waist. The brain fog is real, right? We
Yeah.
used to be able to do 7 things at once. Now I can barely do one thing well at a time. So if she's having symptoms like that, what is her first line of defense? What can she do?
Yeah, so I would say the first thing that you should do is not to ignore your symptoms. And I think that a lot of times women are the primary, I call them the primary caretaker of their home, right? The primary doctor of their home. And they're taking care of everything else, or their job, or their families, or their pets, or their partner. And we often kind of neglect our own health. So number one is to not ignore your symptoms. And regardless of how severe your symptoms are, but particularly if they're disruptive to you, to not just say, okay, I guess this is the new normal, but to talk to your physician, to talk to your provider. I think the most important piece of advice that I would give to women is make sure that you are up to date with your annual checkups, which I think is really important to include, not just with your gynecologist, but also with a primary care physician. And recognizing that those are two different doctors. I mean, a lot of women who only have their gynecologist
Right.
as their only doctor. And I do think, especially as you get to 35 and older, it's so important, well, for everyone, but particularly for 35 and older, to actually have an internist or a family medicine doctor or a primary care doctor, because sometimes the symptoms you're having may be a sign of something else. So you want to make sure your thyroid is checked, that your cardiovascular health is checked. But if you're having those symptoms, there's one is just making sure you're up to date with your visits. And then second is know that it doesn't always mean you need to be on medicine. I know there's a lot of women who are worried and nervous about medications. But there's supplements, like magnesium supplementation can help sleep. And there's natural products that you can use. So let's say you're having a little bit more dryness during sex. Womaness has a wonderful lubricant that you could use, and there's natural products. So I think sometimes there's a fear of, I don't want to go to the doctor, or I don't want to reach out to a medical professional to talk about my menopausal symptoms because I don't want to go on medicine, or I don't want to be on hormones. First of all, there shouldn't be a fear of that. I think unfortunately in the last decade, we had this fear that hormones were bad. And I think for an appropriate person, they're good and can be super beneficial. But I also want women to know that there are some products that you can use that can help your symptoms. And then sometimes just taking a natural, a really intentional look at your day-to-day activities. How much coffee do you drink in a day? How much alcohol are you drinking? What are your nightly habits, right? I think so many of us are now chained to our phones and don't give our brains our ability to kind of unwind towards the end of the day. And then, or at the moment our eyes open in the middle of the night, we grab our phone, which escalates our cortisol levels. And so there's just some personal hygiene things that can be really helpful too. So it doesn't always have to be, need to be on hormone replacement. There's a lot of things that we can do in an intentional way to help address our symptoms as well.
Right. And at Womeness, as you said, we have products and they're hormone free, they're estrogen free, and that is a great first line of defense. If she doesn't have the right doctor, she has a doctor, she doesn't feel like she's getting the help, or she doesn't have a doctor and she needs to find one to help her through her perimenopausal journey, how can she find one?
Yeah, absolutely. And obviously Womaness reaches people all over the country. So certainly Kindbody can be a resource. We have virtual consultations that are available across the country. So that's certainly one option where you would be meeting with a board certified physician and, providers who can help you through those symptoms. If that's Other options can be, the North American Menopause Society. It's called NAMS, has a website. They have providers there, and so I think that's also a wonderful opportunity. I think the other thing I would encourage women is to advocate for yourself. If you are at your gynecologist visit or you are with your primary care doctor and you're like, I'm having hot flashes, and you feel like it's dismissed, like, oh, that's normal, to ask that follow-up question of, well, but is there something I can do? Have we checked all my, is my thyroid, like, I think just, I really encourage women to advocate for themselves and don't just allow your physician or your healthcare providers to be flippant about symptoms that you're having or to be dismissive of them, but to come back with questions. And then if you truly are finding that your provider is not addressing them, then that's probably a good time to make that transition. Now you need a new provider to be able to meet you where you are at this stage of your life. But I think Kindbody can be a good resource. And then the North American Menopause Society too, I think is a wonderful resource. It obviously reaches the entire United States, and they have a nice provider listing that's available on their website as well.
What kind of tests can she expect when she first goes in for her first visit?
Yeah, so I think it's really important to understand that menopause is not something that happens to us in a silo. It's not like, your eyesight changes, which that happens too, ladies.
Literally overnight.
Yeah, literally overnight. I know you start holding your phone a little bit further.
Yep.
But our eyesight, for example, is something that happens to us in a silo. Like your eyesight, your vision is your vision, and then you can get readers or get your eyes checked, and then they give you glasses, and then you're good. Now you can see. This perimenopausal period and menopause isn't just happening to one part of our body, like the glasses analogy that I just gave. It impacts our entire body. So when we think about, okay, I'm in this perimenopausal, menopausal state, what testing should I do? It's all the testing. Make sure you've had your vision exam. Make sure you've been to the dentist. Make sure you've had a primary care visit. Make sure you are up to date with your colonoscopy. Make sure you've had your mammogram and your breast cancer screening. Make sure you've had your pap smear. Make sure you've had your cholesterol checked, right? Make sure that all your hemoglobin A1C, which is for diabetes screening, if you have other risk factors based on your family history. So it's not just one thing, it's all of those things. And I just named a few, your thyroid function. And so those are all really important pieces. I personally, and I do want to be upfront that there are different schools of thought on this, but I personally am not a huge fan of over testing hormones, specifically estrogens and progesterones and testosterones and DHEA in this perimenopausal, menopausal state. There are some functional medicine and some doctors who I think test that a lot. I'm not confident in the value that it brings because there's so much broad variation. So what is normal? And so that I'm not a huge proponent of. I think that I'm more of the school of thought of addressing the symptoms. So if you are having a combination of hot flashes, night sweats, vaginal dryness, the brain fog, the joint pain, so you have a compilation of these issues and you have no contraindications, then I'm going to put you on hormone replacement therapy with your consent and with talking through it and making sure that that's something you're amenable to. I think all of those things are so important, but I don't necessarily, it's not something that I would start you on because your hormone level it's based on your symptoms and based on the compilation of your symptoms and your medical history. And a partnership decision between me and a patient that this is the right path for you. Whereas sometimes patients will say, I'm not quite ready for that. Let's try some non-estrogen containing products like Woman-S has, or let's do some intermediaries. But I don't know if I would just caution people if you're going to a doctor and all of a sudden they're giving you like $1 million hormone testing workup and they're telling you need to come back every 1 to 3 months to check on it, because I'm not sure there's a lot of validity in that. And I do find that there's a lot of women who are spending a lot of money in this perimenopausal, menopausal period, getting a lot of blood tests that I'm not sure are warranted.
It's interesting you say that because I had a blood test a year ago and my doctor called and he left a voicemail on my machine and he said, okay, you're in perimenopause. Well, no big surprise because I'd been doing that for
Sure.
10 years. And he said, and give me a call because I can give you a prescription to help you with those hot flashes. And at that time, I had not had a hot flash yet. I'm like, what is he talking about? I don't
Yeah,
have
yeah.
hot flashes, right? So to your point, he was helping me based on the numbers, not based on my symptoms, because I wasn't suffering from hot flashes. Now, 6 months later, I got hit with them like a freight train. But in that moment in time, I was like, what is he even talking about? That's not my problem. I got
Yeah,
other problems.
exactly,
It's not that
exactly,
one.
exactly. And so to me, in that case, it's making sure that, okay, great. I either because my periods have stopped or because I had my FSH is a test that
Right.
probably your doctor did. So FSH, which is follicle stimulating hormone, once it rises to a certain threshold, we know that this is one of those tests where the higher the number, the more likely you're in menopause, where we can say, yep, definitively based on your follicle stimulating hormone level, you are menopausal or you're not. So that is one test that can be done if someone is not sure. And that one I do agree upon, but certainly doesn't need to be tested on a monthly basis or every few months. So when we do, then it's, I think, not so important in your case, like where you weren't having symptoms to say, here's some hormone replacement therapy, but more so to be like, aha, okay, my body is changing and I need to make sure I'm addressing the changes that are happening in my body. I need to make sure that I am doing weight exercises because I recognize that now that I'm going through this change, my muscle mass is going to change. That because of the decline in estrogen, my bone density is going to change because estrogen is a very important part of our body's absorption of calcium. So I need to start taking more calcium, right? Or my estrogen levels are declining, and I know that declining estrogen levels can affect my cardiovascular health. So I need to now more than ever be mindful of my salt intake and be mindful of my blood pressure and be mindful of the foods I'm eating and to make sure that I'm being active and that the result of this change, my metabolism is changing. And so even though I'm eating the same and walking the same, I'm probably going to have some abdominal weight gain.
Right.
And how can I address that? So I think that that moment, instead of being like, here's a prescription, should have been like a education moment on here's all the changes that are happening. And here's some of the things either naturally, activity wise, supplements, diet that you should be doing to help you through that transition. And unfortunately, I think just we as a society, as a healthcare system, don't put as much on preventative health. We're usually very reactionary.
Mhm.
And in this case, an ounce of prevention can really be so impactful.
Right. And it is not a one size fits all. This is a
No,
very individual journey. Everybody's is, while if we are lucky to be alive at this stage in our life, you are going to go through it if you are a woman, right?
yeah,
But there is help out there for you. Number one, you're not alone. There are ways to get educated and you can get help. So I just want to thank you so much for everything that you have done for Women Us. We really appreciate our partnership with you and being able to talk to you and have you as a resource because it is a very, very important conversation.
truly important. And I think that I really want to applaud the Womaness group and organization in that your mission of destigmatizing and this transition period in a woman's life, this natural transition period. It's not a disease process. And to have really readily accessible products that are helpful and not hormonal and can help people or can be a part, right? It's not like it's a magic solution, but can be a part of the solution combined with good diet, good exercise, making sure you're up to date with your health care needs, and potentially maybe yes, maybe no hormone replacement as well, depending on the need. But I think the combination, it just serves as such a great adjunct for women. And I think the more we have these conversations, the more we talk about menopause, whether it's in our small circles at work, bigger community, the less scary this topic becomes. And then we can really help, advance just women's health and reproductive health.
Thank you. And thank you for your time today.
It's my pleasure. Thank you for having me.